This is 7 National News, and in our top story, the UAE Vice President, Prime Minister and ruler of Dubai, His Highness Sheikh Mohammed bin Rashid Al Maktoum, has stated that the UAE has emerged as one of the major incubators of innovation and future technology in the world today, and its focused initiatives to shape the future have become global models that can be emulated in all sectors. His Highness Sheikh Mohammed made the statement while the opening of the Office of the Future, the first 3D printed office in the world. The unique building on the Emirates Towers premises will house the temporary office of the Dubai Future Foundation. Also present at the opening was the Crown Prince of Dubai, His Highness Sheikh Hamdan bin Mohammed bin Rashid Al Maktoum, the Deputy Ruler of Dubai, His Highness Sheikh Maktoum bin Mohammed bin Rashid Al Maktoum, and Sheikh Ahmed bin Mohammed bin Rashid Al Maktoum, the Chairman of Mohammed bin Rashid Al Maktoum Foundation. The ruler of Dubai pointed out that the opening of the first 3D printed office in the world was achieved after less than a month of launching the Dubai 3D printing strategy. The design of the building takes into account the integration of a unique building design and 3D printing technology to offer key services within the building, and has office space that covers up to 250 square meters, while the exterior design reflects the most innovative forms of future workplace. The 3D printed office was constructed using a special mixture of cement and a set of building materials designed and made in the UAE and the United States. According to local reports, the full model took only 17 days to print, after which the internal and external designs were adopted. The office was installed on site within 2 days, which is significantly faster than traditional construction methods. The Emirates Red Crescent has announced that 3 million people across the UAE and in 63 countries worldwide would benefit from its Ramadan programs. This was announced at a press conference held at the ERC headquarters in Abu Dhabi to launch the sessions for the holy month of Ramadan in order to mobilize support for the disadvantaged nationwide and abroad. The ERC said that this year's campaign, including Iftar, Zakat, Eid clothing, and Mir Ramadan, will be more comprehensive to keep pace with expansion in humanitarian and development projects. The ERC's Deputy Secretary General for Local Affairs also stated that the Ramadan programs this year aim at strengthening communication in the UAE community and boosting partnerships to support the ERC programs locally and abroad. In an effort to improve the quality health care for patients, UAE authorities and leading doctors and health practitioners in the industry have highlighted the need for a unified code for patient safety and quality innovation across the GCC region. During the 4th Annual Middle East Patient Safety and Quality Congress in Abu Dhabi today, healthcare authorities representing a GCC region highlighted that patient safety is also a human right, and while many steps have been taken to improve patient safety in the region, more needs to be done to meet international standards. Stating that only 25% of healthcare services in Saudi Arabia are provided by the private sector, officials stress that public-private partnership, along with a unified code for patient safety across the board, is crucial to put in place a comprehensive network for patient safety in the region. The 3-day medical congress in Abu Dhabi, hosted by Abu Dhabi Health Authority, in collaboration with the Health Ministers' Council for GCC states and the Saudi Quality Council, included panel discussions on many topics, such as difficulties in implementation and enforceability of standards and developing a common applicable benchmarking system.
Most of the GCC medical providers, they are non-citizens, and so we have difficulty in their schools. They are from almost more than 100 schools all over the world. And second, the language barrier. Third, that they come and they need continuous training and continuous professional development, and also we have a diversity in their knowledge. So this, it should be unified, it should be standardized, and to make sure that they are up to the standard, up to the guidelines, international approved guidelines. So we in the GCC introduced the evidence-based medicine approach. Also, we introduced the quality and the patient safety as a very crucial subject in order to have a unified approaches. So we had what is called the strategy for patient safety and quality, and it was from 2011-2016. Then we revised it just a few months ago to 2016 to 2020.
Our vision around high-quality patient care stems from the Abu Dhabi Health Authority vision, which is towards a healthier Abu Dhabi. Now, what does that mean, and how we did it is we developed a strategy for the healthcare sector as a whole that goes into the next 5 years. This strategy has 7 themes. The second theme is mainly concerned about improving and sustaining and making a world-class quality of care in the Emirates of Abu Dhabi, as well as supported by research and innovation base that will prompt it and provide the basis for that.
Adding that patients today are driving the issue of providing quality healthcare services, officials stated that as healthcare issues are global in nature, healthcare providers across the board need to share best practices and create a learning environment to ensure patient safety.
The problems with healthcare are global. We have people who are living longer. They have more complexity to their health needs. They have more than one problem, so we call that comorbidities. We know that our aging population are becoming increasingly frail. So what we do is we have a commitment to understanding the evidence base and the learning on how to best care for them through integrated care projects, through innovation, through reshaping new services to meet those needs. And then what we do is we apply that learning into local context and culture anywhere in the world. So we've worked extensively through the Gulf regions. The major burdens of disease like diabetes, cardiovascular disease, stroke, heart attacks, and some of those issues are global issues. So we can share and learn from each other.
And hospitals in Abu Dhabi that provide inadequate treatment or fail to meet quality targets will have their funding cut, with the new rules set to affect all 41 public and private hospitals in the Emirate. According to local reports that quote officials from the Health Authority in Abu Dhabi, funding cuts may be applied directly to public hospitals and to private hospitals by reducing their grants or holding their payments from health insurers. The scheme is still being developed and no date has been set for its introduction. Financial penalties for hospitals that deliver poor quality care are the latest stage in a drive by the authority to establish and enforce standards of healthcare, which began with the Jawda or Quality Initiative in September 2014. Jawda indicators cover safety, effectiveness of care, speed of its delivery, and ensuring that patients come first, with targets in each area. On Monday, the authority introduced 13 quality metrics that fall under patient safety and effectiveness of care. The authority said further improvement was needed in standards for emergency care, infection control, and perinatal and maternal care, but added that more hospitals are meeting their overall waiting time targets, with 87% last year compared with 82% the year before.
We started with a measurement. We also started with holding to account and having conversations with the different hospitals that participate in this program in order for them to understand why their performance has been to a certain level, being good or being bad, because you can learn from good as well as challenged situations, and then get them to develop action plan that we hold them to account against, and we have discussions about it and say, okay, where is the improvement, what happened with this improvement, how can we support you in order to get an improvement. In the medium term, there will be a linking of that performance to the payment that the hospitals receive from the insurance. So for example, if the hospital receives certain X amount of money per year from the insurance for the services they provided to the patient, that money might get increased or decreased depending on the quality of the care or the level of the quality of the care they provided to their patients as assessed by the health authority in conjunctions with the insurance companies.
The UAE has become the first country in the Gulf region to partner with the International Labour Organization for implementing a labor governing program. The announcement was made during an event organized by the Ministry of Human Resources and Emiratisation in Abu Dhabi on Monday. Senior officials from the ministry and the ILO said a new strategic program called Innovations in Labor Market Governance has been developed in close collaboration with the ILO to improve working conditions for employees. The new program will focus on three main pillars, including labor inspection, dispute resolution, and enhancing the labor market information system. The UAE hosts around 4.5 million foreign workers, making it one of the largest labor-receiving countries in the world. Scientists are warning that more dust storms could be in store for the Arabian Peninsula due to the worsening effects of climate change. Scientists in Saudi Arabia, Germany, and Cyprus have used satellite data to study aerosol optical depth or the ability of airborne particles to absorb or diffuse light. The study was conducted over the Arabian Peninsula from 2000 to 2015, and it indicated that the amount of naturally occurring dust particles, which are among the major airborne pollutants in the region affecting human health, is expected to increase as human populations grow and the impact of climate change becomes more pronounced. The scientists believe that as temperatures increased, as a result of climate change, general drying would probably lead to more dust storms. The research was published days after a paper which examined the link between climate change and the rising temperatures. It warned that hotter summers may be in store for the UAE and other Middle Eastern countries. And finally, in the Bulletin Index, the GCC's biggest event for sourcing interiors and design products kicked off in Dubai for the 26th edition at the Dubai World Trade Center. Welcoming 350 new exhibitors compared to last year's edition, the organizers stated that the total this year is more than 1,000 exhibitors. They also added that the value of the GCC interior and fit-out market has risen and is now worth an estimated $7.35 billion, an increase of 25% from previous years. Samantha Kane McDonald, the event director of Index DMG Events, said that the event offers the best opportunity in the region for the design community to come together for networking and sourcing products, and judging from the buzz, it's set to be the best year yet.
This is the 26th edition of Index. This year we have grown again. We had 750 exhibitors last year. We have 800 this year. And really interestingly, this year, of those 800 exhibitors, 350 of them are brand new to this region. And we also have 2 new country pavilions, one from Qatar, which is wonderful to see, and another GCC country coming into the UAE, and also Russia for the first time, a Russian pavilion, which is very exciting. It's something nice and new and fresh that people haven't really seen before. We launched Discover 3D printing this year because there's so much interest in this aspect of, especially for design and product designers in particular. And it's something that's really new and exciting, and technology is so important in our day-to-day lives now. So yeah, 3D printing is definitely the way of the future.
Highlights at this year's show are set to include the Index Design Innovation Forum, a brand new feature that has been created to support the UAE's vision of remaining a global pioneer in design and creativity. The Index Contemporary Furniture Design Competition in association with Home Outfitters, and the Retail Design Competition. The Media Awards and Index Style Guides also back for another year running. Additionally, Workspace at Index presents 7 brand new sectors for 2016, including retail space, fit-out, furniture, interiors, management, and storage, with visitors expected to meet, connect, and source from over 150 suppliers from 20 countries across the 4 days. Other highlighted features include the Discover Workshop in association with Pro Technology, where experts will share their knowledge on a hugely popular trend, 3D printing. Designers can submit their own designs into a competition for the chance to win their very own 3D printer.
Pro Technology is actually showcasing a variety of products. We have our 3D printing division, our UV printing division, and we have our solar division, among a variety of other products. UV printing has a lot of benefits here. We work with a lot of mosques, museums, and restaurants. You can literally print on any surface these days. It utilizes ink and dries it using UV light. 3D printing is more common with designers, architects, and university students. We are actually getting a lot of inquiries about it, and many businesses are actually moving towards 3D printing and UV printing. It's more cost-effective, more efficient, and it's more hygienic these days. And in such weather as in Dubai, it lasts very long.
This year we are showcasing how you can make a dome out of our product. That's why the stand looks like a dome made from a European and an Islamic fusion design. So we tried our best to do this in our design. Hopefully it will give the message, and it will help all interior decorators and exterior decorators use the product for their benefit and our benefit, because our product is an eco-friendly product. It is Class A fire retardant. It is 100% recyclable, and it is something that you can use outdoor, and it can stand the heat, it can stand the water, the humidity, UV rays, up to more than 20 years.